Hi, my name is Daphne, and I'm going to be talking about eating disorders. Dion doesn't talk about it, a silent enemy that takes over her life and takes over everything. Every day, she has the infinite desire to be normal. Her inner self doesn't stop repeating, humiliating her body. Imagine not eating at all. Imagine uncontrollably eating so much that you just end up throwing up everything right after. Imagine compulsively exercising every day to the point where it's not even normal. Imagine spitting out every single bite of food that you take. Imagine eating unusual things like soap, soil, laundry detergents. According to registered dietitian Anila Preet in her article, Six Common Types of Eating Disorders, last accessed February 1st, 2021, eating disorders or mental health conditions marked by an obsession with food or body shape. They can affect anyone, but are most prevalent among young women in the United States alone. An estimate 20 million women and 10 million men have or had an eating disorder at a certain point in their life. Today, we would learn about eating disorders. We would discuss what eating disorders are, its effects, and its treatments. First, let's talk about what eating disorders are. In 2019, dietitian Anila Preet classified eating disorders as a range of psychological conditions caused by healthy eating habits to develop. They might start with an obsession with food, body weight, or body shape. Those with eating disorders can have a variety of symptoms. However, most include a severe restriction of food, food binges, or purging behaviors like vomiting or over-exercising. What does this mean? Let me show you a picture of this girl who's extremely obsessed with her body weight and body shape. Do you guys notice her appearance? She's extremely skinny. She can barely eat anything, and often these kind of people with these disorder hear a voice that keeps telling them that they're not even hungry or that they shouldn't eat at all. In a 2019 video by Psych2Go, last accessed February 1st, 2021, a professor of psychology explains that there are 6 types of different eating disorders. Let me give you more insight about this topic. There are 6 different types of eating disorders. These include anorexia nervosa, bulimia nervosa, binge eating disorder, pica, ruminator disorder, and avoidant restricted food intake disorder. Although eating disorders can affect any gender at any life stage, they're most often reported in adolescents and young women. In fact, 13% of you may experience at least one eating disorder by the age of 20. Eating disorders are a mental health condition marked by an obsession with food or body shape. Now that we explored what eating disorders are, let's discuss its effects. Not only these eating disorders harm a person's body, they can only affect a person's mind, co-occurring along other psychological and dangerous disorders like substance addiction and leaving lasting emotion effects. Despite only weighing 3 or so pounds, the brain consumes up to 1/5 the body's calories. Dieting, fasting, starvation, and irritating eating. However, despite the brain, the energy it needs to properly function and concentrate. A slow digestion, food restriction, and vomiting can both interfere with a person's normal stomach emptying and the digestion of nutrients. According to National Eating Disorders Association, last accessed February 1st, 2021, eating disorders can cause a person's body temperature to drop. Now that we discussed some of the effects of eating disorders, let's explore treatment options for these disorders. There are a lot of different treatments for eating disorders. These include therapy, education, and medication. According to Mayo Clinic, last accessed February 1st, 2021, it typically includes a combination of psychological therapy, nutrition education, medical monitoring, and medications. Attempts at treatment may be met by restriction, fear, or denial because potential patients feel like achieving their ideal weight and they have issues with that. According to writer Barbara Watson, last access February 1st, 2021, some patients need serious treatments requiring hospitalization so that they acute health problems and they can be addressed. Other patients may seek treatments as a non-hospital environment, often therapy, medical care, and nutrition support. It depends on the progression. Um, Today, we learned about eating disorders. We talked about what eating disorders are, its effects, and its treatments. Uh, you will be surprised at any time to find out someone you know has had an eating disorder problem. In the United States alone, an estimate 20 million women and 10 million men have had an eating disorder at some point in their life. Living with the eating disorder is challenging. I am sure we all know how it feels not to be satisfied with yourself or body, feeling like we're sick every day and it doesn't get better. For people like Dion, this is a reality and a struggle she faces every day. Now that you know more about this topic and are more aware of this disorder, let's respect people that have it or are facing it. Thank you.